Mr. Deluyker, the floor is yours.
Thank you very much, Chair. We'll see the first slide in full size in a minute. And let me take the opportunity to say that this meeting here comes at a very interesting time for us, because the management board of EFSA will meet next week on its 5-year strategy. I'll develop some themes that are considered in this plan. And secondly, we also have our triennial scientific conference in the middle of October, where I can say that the openness and transparency, if you look at it, is not only the subject of 2 breakout sessions, but also of a plenary session. With regard to the openness and transparency, we think that is a major opportunity to also look at the debate about independence from a different perspective, because in as much as you open your data, your methods, and who has contributed what in terms of expertise, it's reproducible. And that's a key element of science that I think we need to take advantage of. Another element that you'll see throughout the presentation is that with the resources that EFSA has available, we're trying to build on what others are doing. And I'll give a few examples of Commission initiatives. The structure of the presentation is, as shown here, the mandate. The mandate is, of course, a key phase in the whole process because it will drive your answer. The data, how can we stimulate two-way interactions? Methods, we're developing a lot of methods to strengthen this openness and transparency, but we have to manage that cycle. The expertise has an element, as already mentioned several times this morning, of weighing competence and independence. And then finally, I want to say something about outputs, and perhaps, if time allows, put it in a broader context. With regard to the mandate, one of the things that we are indeed debating at this moment is, for complex mandates, which are often the most controversial, how can we frame the question with public societal participation? It's a very important issue, because you have the discussions afterwards with the disagreements about the results. It's very important to try to be proactive, and for big societal questions, I don't think we need to name any, a proactive approach on the mandate, in the mandate phase, I think is important. Another issue, taking it from the other side, is that we are very often singled out also, not only for independence, but also for being very reluctant to have any engagement with applicants for regulatory products. It's something we'll have to consider, but it has to be considered in this framework of openness and transparency. That's as far as the mandates is concerned. On the data, EFSA has invested throughout the years in data collection, much of which comes from the member states. But we can do better in that, because very often data collections take place at the time a question is being raised. That's not a way to go about things. We need to be more proactive if we want to meaningfully collaborate with member states and research institutions. And I think, indeed, as already mentioned at the introduction of this, the prioritization of the EFSA research agenda, or in fact of the agenda of all the organizations that are providing advice, is a key element. We won't talk today about how much the FDA has invested in BPA studies at this moment, but we think we need to reflect on those issues. The second element is then about the open data approach. Yes, we want to strengthen this open access. We have a data warehouse, which I'll schematically show in the next slide, which is data from the member states. We have there two elements. Let's be frank about it. We have a technical capability element, which EFSA and the member states can work on. And then we have a legal discussion. Who owns the data? Is it the lender in a country? Is it the country itself? Is it actually the person? Those are the legal discussions where indeed we might need a bit of help. The second point on the previous slide was then the fact that here's an example of, if you will, EFSA has developed a food classification system with the member states in the various silos that we have, whether it's GMOs, pesticides, contaminants, microorganisms. We have 28 member states per silo, and we have managed to standardize that, including for food consumption, which is essential to get anywhere. But being responsible for that niche, we're now reaching out and starting cooperation through the ISA system, which I think is making use, rather than developing something completely new, again, in isolation. We're seeking cooperation on this example through DigiDigit. This is a schematic system, representation of our system, where there is automation of transfer, validation at entry. So technically, we have advanced very much, and we are able to give access to the member states to their own data that are stored. Next one. What are next steps? Well, we talk a lot about crowdsourcing. We're experimenting with this, for example, in bee health. It's very difficult to get good information on bee health, but beekeepers know very well what's going on. So we are, as an example, working on this. Then data collection, as you've heard already today, there is always discussion about, well, what are these experts really doing? And the examples that I'll give here and also on the next slide try to be more to help experts use very reproducible systems. One is the famous expert knowledge. Well, there are systems for expert elicitation. We're putting that in place. So it's not like, well, it was my opinion on that day. No, there are methods there to be followed. And another one where we're working with e-infrastructure through one of their projects is on literature retrieval. We've done a lot on literature retrieval, but we can also benefit from this commission system. The Matrix product is about regulated products where, of course, we would like to automate submission and validation. We would like to harmonize structures. And please keep in mind that when EMA talks about release of information, it's because through their much longer existence than EFSA, they have over the years between the US, Japan, and Europe been able to establish a harmonized platform for data structure and data submission. We have been blessed with 30 different regulations to cover all these fragmented areas of the regulated products alone, which of course means that it's a much bigger effort to try to come to some standards of harmonization. At the end of the day, our goals are transparency, efficiency, and indeed reuse of data. Going on then with methods, we have pioneered systematic literature review, again taking it over from the medicines area where for clinical trials it had been previously developed. We're also now refining that a little bit further, and you can find that on our website with critical appraisal tools. If you're going to evaluate the study, you have to say, well, these are my criteria, and this is what I'm sticking to. Critical appraisal tools are a next step. With regard to risk assessment methods then per se, we have the famous Prometheus project, which basically says, well, a risk assessment is like a paper that you're writing. You're saying what your objectives are, you're going to say what you're going to do, you do it, and then you say whether you did it or whether you had to deviate. So it becomes, again, a key element for transparency. We are pioneering, as you know, a guidance on uncertainty. I think it's not something unique for EFSA, but somebody has to do it. We are also looking at weight of evidence, biological relevance, and in order to pre-start guidance development on monotonic dose response, which is of course a very important issue currently, we're working with member states to begin to collate the science on this. I think finally it's very, very important for EFSA to take stock of the new science. We have in our scientific conference a plenary session which includes what are the effects of epigenetics, the evolution of epigenetic science on the risk assessment methods, microbiological, gut flora, neuroscience, etc. So we must constantly, on a regular basis at least, assess the new developments of science. So researchers need to take to regulators, and as I said earlier, the regulators need to make clear to the researchers and those that are responsible for allocating money what our needs are. Another issue that you then run into as you accumulate guidance is that you need to manage that. You need to train the experts. You need to check on the relevance of the guidance after a number of years, and then reconvene the cycle. So that cyclicity is something that we've now built into the tasks of the scientific committee of EFSA. Expertise. Surely, as I said, if you want your experts to be up to speed, you need to regularly train them on the new guidance. And these are some examples. I won't go into them. But a more important issue for Europe is that with the creation of EFSA, we've given the responsibility to quote-unquote independent experts. So where are the member states that actually have organizations that used to have responsibility, for example, for the evaluation of feed additives? Do they still retain any urge to train their experts? It's a major issue. The average age of our experts is 55 years. So yes, we're going to discuss that also at our scientific conference. Finally, let's not be blind for the future. Computer-assisted decision support systems are coming our way. We're going to start one experiment on that. We have a speaker from the computer industry talking at our scientific conference. It's computer-assisted. That means, like in pesticides, we get tens of thousands of reports every year. You've got to develop systems over time to help make sure that there is consistency, that the guidance have been developed. It's very difficult for individual experts to keep track of that. The decision is still with them, clearly. But machine learning will help us. Okay, on the famous independence. It's not with any devious plan in mind that this is so hard to read. It's because we try to put so much information in it. Essentially, we've had several cycles, one of the main ones being the 2012 revision, where we're that has also resulted in 2014 in a further refinement of our software. The bottom line is that the system is running at this moment, but in 2016 we'll have another cycle with a policy review and possibly implementing rules that will be revised. Of course, I can address, if you wish, some of the questions that were raised earlier, but maybe we leave that for the Q&A session. So basically, we're working with cycles, and every time the software that goes along has to be revised accordingly. Next one. On the outputs, we of course have public consultations on key issues. One of the issues that may be raised is, well, what is your peer review system? I'll come back to that in a minute when I talk about the work with other agencies, but it's something that we're looking at across agencies at the moment. Data linkage is an important element of output, so you don't have only the report, but you also have the linkages eventually to the original data sets with all the restrictions that were already discussed. On the communications side, we want to strengthen our collaboration with the Office of Publication. There are some agencies that are huge providers of data and others much less. And of course, like everybody else, at some point we need to engage in a more professional manner with the social media. What I wanted to mention is that there are many agencies. EFSA is probably one of the bigger ones, although much smaller than in financial resources than, of course, EMA. But if we talk about peer review, if we talk about the uncertainty, does every agency need to replicate and develop these methods all on its own? In 2013, this network of of agencies, scientific advisors was created, and gradually we're trying to see, well, what are issues of common interest, and one of which that we're working on is peer review. Because the classical peer review system obviously doesn't work for us as agencies, but it doesn't mean that there are not elements of peer review that can be interesting. And that's what we're doing as one of the topics at the moment. I hope that was more or less within time.